Hello, I'm Dr. Ruggiero, a practicing emergency medicine physician and associate professor with Texas A&M College of Medicine. And we're going to briefly review how to use an ophthalmoscope and otoscope. All right, so this is a direct ophthalmoscope by Welch Allyn. It's a combination of ophthalmoscope and otoscope set. This is the handle. Here is the cap to change the batteries if you need to change the batteries. Here's the otoscope head, and here's the ophthalmoscope head. There are notches there with cutouts here. You just line those up and twist the head less than a quarter turn to secure the ophthalmoscope head. This is both the on-off button and a rheostat. The rheostat controls the intensity of the light. So to turn on the light, you depress the green button and you twist it over, and the light is on. To control the intensity of the light, you just twist that rheostat back, and it'll make it less intense or more intense. And to turn it off, you twist it all the way until the green button pops on again, and it's now off. So we've turned on the ophthalmoscope, and so let's look at, this is the patient side of the ophthalmoscope, and this is the examiner side, or the back side, where you're looking through. On the back side, we have a brow rest. Here you have the viewing window, and then your focus is done in diopters. And so if you have 20/20 vision and your patient has 20/20 vision, you set this to 0, and you should have a clear image. If you have to adjust the focus, you can do positive diopters that are green or negative diopters that are red. When we turn to the patient side or the front side of the ophthalmoscope, there are two additional places where we can make adjustments. This is where you choose which filter to use, and this is where you choose the aperture settings, and we're going to look at both of those. So for your filter options, you have a non-polarizing white light versus a polarizing white light. The most common setting is to have it on this polarizing white light, so the circle, the open circle. There is additionally a green light that is also known as a red-free filter. And what that does is it helps you better visualize the blood vessels in the retina by increasing the contrast. So you can see when I switch it to the green light, it gives you a green, there's a green light there, red-free filter. Below the filter setting, which only has those three choices, is the aperture setting. The aperture settings are 6 choices. The first 3 choices are white light circles, a small circle, medium, or large. When you're using dilating drops on a patient, you'll usually have the large circle. When you're in a dimly lit room, but the patient's eyes aren't dilated, usually the medium circle is the common setting. And if you're in a brightly lit room, which is not ideal, you would choose the smaller circle so that there's less reflection of the light impeding your view off of the cornea. So those are 3 of the aperture settings. Again, here's this wheel for the apertures. The 4th aperture setting, it includes a grid so that you can describe relative distance of, for example, lesions that you might notice. This is the slit light setting, aperture setting. This allows you to see contour. So right now on this surface, it might look like there are raised areas, but no, that bar of light remains a single bar of light. As opposed to, for example, here, I can start to see where the bar of light bends because of the raised surface on this pillowcase here. The 6th aperture setting is a blue light. So don't confuse your blue and your green light. The green light is a filter setting that's here for better contrast to look at blood vessels. The blue light is one of the 6 aperture settings here. A blue light is used with the addition of a type of stain that we place in the eye called fluorescein. And where there's been damage to the corneal surface, fluorescein concentrates in those areas, such as a corneal abrasion, or if you have a herpes simplex virus infection, you'll see a dendritic pattern on the cornea. And so you place the fluorescein stain, and when you shine this blue light on the eye, on the cornea, it will light up, and you'll see the contrast for where there's damage to the corneal epithelium. So now let's go ahead and put this all together. So again, when we first start, we're going to want to make sure that we have it set to the open circle. Set your aperture window so that it's the medium circle. Decide on the intensity of the light that you want so that you can keep the patient's pupil as dilated as possible by having a lower light setting. And now let's look at how we actually examine a patient. All right, so now we're going to put it all together and we're going to examine our patient. I'm first going to turn the ophthalmoscope on. I'm going to set the diopters or focus to 0. I'm going to confirm that I have the filter setting on the open circle, that's a polarizing light. I'm going to confirm that the aperture is where I want it, and since I'm doing an exam of the retina, I'm going to in a dim room, I'm going to set it to the medium-sized aperture setting. And what you have to remember is that the optic nerve is located more nasally, and the macula and fovea that's responsible for our central vision and has a high density of cones responsible for our day vision is located more towards the temple side of the back of the retina. The reason that's important is because when I approach the patient, I'm going to have the initial light pointing more towards the nasal area. So I'm about 15 degrees off center, so that the light from the ophthalmoscope does not cause her pupil to constrict. I'm going to save examining the macula and fovea for the end of the exam, and I might even decrease the intensity of the light before I shift to look at the temporal location, given, again, that high concentration of cones in the fovea and macula. When I examine a patient, if I'm examining her right eye, I'm going to hold the ophthalmoscope in my right hand, and the reason for that is that as I examine her eye and as I come closer, my hand will act as a barrier between my nose and mouth so that I don't accidentally come in contact with my patient's nose and mouth. When I'm examining the left eye, I'm going to switch the ophthalmoscope to my left hand. Again, I'm going to begin initially by pointing towards the more nasal area, about 15 degrees more towards the nasal area. And I'm going to approach, I might have my hand on her shoulder with her permission, and I'll approach the exam in this direction. Again, keeping my hand between her nose and mouth. If I'm like this, then there's a risk of accidental inappropriate contact. So I have it set, and I'm moving into, I start by identifying the red reflex. It's a red-orangish reflex. And then I move in. If at any time I lose the red reflex, I back out. And a lot of times here is where people then they say, well, I can see some red stuff, but I can't make out details. And that's usually because they have to adjust the focus by turning the diopter wheel to adjust for changes in your vision or in the patient's vision. All right, so this is the handle. This is an ophthalmoscope and otoscope combination case. This is where you change the batteries if you need to change the batteries. We're going to be doing an otoscope exam or ear exam, and so we're going to select the otoscope head. There are cutouts here and notches here. You just line those up and turn this about a 1/8 turn. This is where the on button is, and that on button will turn on this light. It's on a rheostat, meaning a variable resistor, so you can change the intensity of the light by twisting this more or less to the left or right side. The most important thing with an otoscope is to know that there is a focus knob here, and so you can change the focus knob. If you have 20/20 vision or using your glasses to get 20/20 vision, you can set this to the center and that's set to 20/20. This will change the magnification to put the whatever you're looking at in focus. You need to get an otoscope speculum, and you'll notice that the speculum has these three projections here. There are three cutouts here. You just line those up and twist it to secure the speculum in place. And then you make sure that your light is on and you are ready to do the exam. For both your otoscope exam and your ophthalmoscope exam, it's important to remember that you need to focus the view. The most common reason why students have difficulty using an otoscope and an ophthalmoscope is that the image is out of focus because they forget that both of these instruments require focusing. All right, and so now we're going to do an ear exam. I have my otoscope here. I'm first going to make sure that I move the focus wheel so that it's set for my 20/20 vision. I might have to adjust that as I'm looking in her ear to bring the image into focus. I'm going to attach my speculum. I'm going to turn on the light by depressing the green button and turning the rheostat. I'm going to very gently pull back on the pinna, or this outer portion of her ear. And when I hold the otoscope, I tend to hold it like this, and I brace my pinky finger against her cheek. The reason I do that, especially if you have an uncooperative patient like a child, if she moves her head all of a sudden, I won't, if I'm like this, I'm going to jam the otoscope speculum into her ear. But if my hand is braced against her face or her temple region here, it will move with the patient as I look inside her ear and observe her tympanic membrane and external auditory canal. Thank you. And so that concludes a brief overview of how to use a handheld direct ophthalmoscope and otoscope.